Vitality Unlimited invited us over to take a look at their new building that they just opened up, and we went. And who went with us? All of HSA. So we opened the doors and up a short flight of stairs and around a couple of corners. We turned to the right, and the next thing you know, we had arrived. We transported our county partners to this tour, so I was on my best behavior. But just like everyone else, we had to take that first bold step. We were greeted by the program director of all people. This tour began in a charming waiting room, furnished complete with a group schedule that was quite colorful, I might add. Heather decided to show us the group meeting room where they conduct the bulk of their meetings. Our guide explained a comprehensive list of services provided through Vitality Unlimited that put smiles on nearly everyone's face. From therapy rooms to visual aesthetics, Vitality Unlimited demonstrated their thoughtfulness throughout the tour. And now you're going to hear from the program coordinator a little bit more about what it is that they have planned for Reno.
So we're Vitality CCBHC. We have been around for over 50 years in Nevada. We started serving our rural communities and serving specifically in substance use. And over the past 50 years, we've really developed and branched out to serve every population with everything going on under the sun. So we are now in Elko, we're in Carson City, we're in Dayton, and we just opened here in Reno. And so the CCBHC is designed to be a one-stop shop for treatment. So it can be so overwhelming when you're going all the way across town to meet one provider and then back across town to meet somebody else, and you're trying to keep all the appointments straight and all of your records straight, and it can be really overwhelming. So our goal is to make that seamless. Somebody can come in and get every need met right away in one place. So we can do case management, individual therapy, peer support, groups, primary care, which can be really hard to find nowadays, medication management for psych medications, which is even more difficult to find, substance use treatment, all of the things that someone may need in one space. And we take most major insurances, all forms of Medicaid, sliding fee scale, and we turn no one away based on the ability to pay. My job here is the program coordinator. So I've been with Vitality for 3 years. I've been in mental health. I'm losing track, but I've been in mental health for over 14 years. So this has really been my life from the very beginning. I started when I was 18 in mental health. So the goal for this population and to serve this community is to meet everybody where they're at. Right? They don't even necessarily have to come in the building. We can do telehealth. We can show up where they are, have sessions in a park, have sessions in the kitchen, wherever we need to really help everybody get what they need, the treatment they deserve, and build that relationship with us. Treatment, especially this kind of treatment, mental health treatment, behavioral health treatment, should be so much more than your boring, typical doctor's visit. Right? You want to be excited to come to treatment. You want to like the people that you're seeing. You want to walk in that waiting room and, hey Joe, how's it going? You want a snack? I mean, I always have snacks, so that's just something everybody should know. So our goal is really to serve everybody where they're at, be a practice without walls, and get creative. If there's not something we already offer, tell us. You know, we want them to be the driving force in their own treatment and be in charge of their own life. They're the captain of the ship. We're just the first mate adjusting the sails. So we're really excited to come alongside people, support people in any way we can, and get the treatment to serve them rather than them serving us. That's how it works here. Primary care is running the full gamut. So we're able to do any number of testing. So sometimes people haven't had their basic blood work, right? We're able to do basic blood work testing, STI testing, diabetes testing, any of those things that people might have concerns about for screening. We can do all of the screenings. We can also do things like managing things that are already occurring. So let's say that you have been diagnosed with diabetes and you haven't taken care of it for years because sometimes life gets crazy. You can come in, we'll get you on track, we'll support all of those things. So disease management, disease diagnosis and screening, we can do all of that. I think another really great service that we have is the crisis service. So it doesn't matter if they're a current consumer or not, if they're in crisis, any kind of crisis, they can just walk in our doors. They're welcome to call if they want ahead of time, or they can come in and say, hi, I'm in crisis and I need help now, and I don't know where to go or even know where to start. They can start with us. We're going to give them that warm handoff. We're going to be that welcoming space for them to kind of feel safe, come down and come up with a solid plan. We do offer all of our services in Spanish as well. So if that's an issue, it won't be an issue with us. And again, we're just really ready to serve people wherever they're at in any way we can.
So of course, you know, this here QR code is going to take you directly to their website. And they do have a beautiful website if you're using a PC. However, should you decide to follow this QR code on your phone, it's going to look just like this. And when you get to their phone version of the website, you'll have to scroll around to find exactly what it is that you're looking for. However, chances are really good that you're going to find exactly what you need should you be interested.